इस पर कार्य कर रहे हैं। दोषियों को किसी भी स्थिति में बख्शा नहीं जाएगा।
Just hours before, when UP Chief Minister is slated to visit this pediatric department, the entire administration seems to have descended here. Doctors are working round the clock.
It started with 22 infants being reported dead at the government-run BRD Medical College in Uttar Pradesh's Gorakhpur city. By Sunday afternoon, that number had crossed 63, and hospital officials, state authorities and central government officials have begun playing the blame game. The deaths have been attributed to a variety of reasons, from Japanese encephalitis to the children being exposed to dirty surroundings and open defecation, and now grudgingly to a shortage of oxygen at the hospital due to an administrative mix-up, though even that is being disputed. While a magisterial probe has been instituted into the cause of these deaths, one cannot deny that this horrific incident highlights the poor quality of healthcare in India, especially at government hospitals. More worrying, India's healthcare system is ironically on life support, even though budgetary allocation towards healthcare has been increased. For instance, India's overall health budget has risen from over 39,000 crore rupees in 2016, that's 1.97% of the total budget, to over 48,000 crores in 2017, that's 2.27% of the total budget. So where is India going wrong? That is the focus of this special edition of What's Ailing India. Joining us now to discuss that further, Kiran Mazumdar-Shaw, the Managing Director and Chairman of Biocon; K. Sujatha Rao, former Secretary, Ministry of Health and Family Welfare; K. Srinath Reddy, President of the Public Health Foundation of India; Vidya, Krishnan, Health and Science Editor at The Hindu; and Shailaja, Chandra, former Secretary, Health Ministry and the former Chief Secretary of Delhi. Ladies and gentlemen, appreciate you joining us here on CNBC TV 18. Sujatha Rao, while we want to discuss what's ailing India's broken healthcare system, I first want to talk about the horrific situation in Gorakhpur. We're short of answers, of any kind of satisfactory answers at this point in time. There is communication that's coming in from hospital administration, there's communication that's coming in from the government, and then you have contradictory reports supporting or not corroborating the statements that are coming in from the government. If you just a plain assessment of what seems to have gone wrong in Gorakhpur, Sujatha Rao, what would you pin it down to?
Well, I'm sorry I haven't been able to hear you very clearly, but from what I just heard, the last few sentences, I think, in Gorakhpur, the whole health system has collapsed. It's a failed district, and UP as a whole is a failed state insofar as health is concerned, public health is concerned. And this is an annual recurrence. It keeps happening. The health delivery system is not functioning. So there is a tendency for bringing in children too late into the hospital. And the hospital administration very clearly has failed to also rise to the occasion and see to it that they get proper care. But, I would really like to say that right now, the most important thing is to have a sound technical body to go and investigate the causes of these deaths, because these are a bit alarming numbers in such a short time. So is it only acute encephalitis, or is it other kind of re-emerging infections that are coming in? We don't know, and we don't have any biomarkers for infectious diseases. We don't have a surveillance system functioning. So, there's a huge amount of ignorance, and just to keep on blaming politicians is not what is required. What we want is a technical report to say, why did they die, could they have been prevented, and what really has happened. And more importantly, to draw lessons and go in and see to it that doesn't happen. Vector-borne diseases have been so badly neglected in our country. And what you need, the only way you can reduce vector-borne disease occurrence in our country is community-based strategies, which are well known. We have it. But they're not being implemented because sub-centers don't function. Hardly 6% of A&M stay there. PHCs don't function, and Gorakhpur has hopeless indicators under every health parameter that you can think of. It has the highest incidence of hypertension, chronic illnesses, highest incidence of diarrhea among children. It is a serious matter, and I think it has to be looked into overall health system that is prevailing there.
You know, you've set up the context for this conversation. Complete negligence, and you've set up the context and you've raised several important issues, and we will get into each one of those one by one. But Mr. Reddy, let me come to you. You know, as I pointed out, and Sujatha Rao also alluding to that we have no answers at this point in time in what was actually the cause of death. Even grudgingly, whether it was a lack of oxygen supply hasn't been acknowledged or admitted by the administration at this point in time. The question is, this magisterial probe that has been ordered, is that going to be of any use? Or, as Sujatha Rao is pointing out, the need of the hour is a technical body, a technical set commission perhaps looking into what led to this disaster in Gorakhpur, and there the lessons learned.
Well, the magisterial probe is only going to find out where the administrative failures were. But this is only an acute manifestation of a chronic failure of the health system in multiple dimensions. Firstly, why do these children fall sick? Why is it such a hotbed of Japanese encephalitis? Obviously, we have viral breeding in rice paddy fields, in the mosquitoes that breed over there. And then, obviously, if the sanitation is not very good and pigs are there and water birds are there, then we find those are the primary hosts, and man and children are accidental hosts, so the hygiene factor also comes in. Then comes the question of the failure of the primary care system for early detection as well as prevention. Sanitation is also part of the health system's duty, but also the whole issue of immunization, the whole issue of early detection and appropriate referral at an early stage to the hospital of a disease which doesn't really have much definitive treatment, but is only supportive treatment. Water and electrolyte balance, airway, and so on and so forth, and treatment of convulsions if they occur. Now, the question, of course, is even at the hospital, there have been clear-cut failures. Whether oxygen supply was actually the cause of this particular problem because of its interruption, or there would have been high death rate in any case, that's for the technical report to find out. But then, again, the big question is, if there was a failure, even on the administrative grounds, that is not likely to be an immediate one-time failure.
The fact that there was a failure has been well established, sir. Mr. Reddy, the fact that there was a failure in oxygen supply has been well established.
Yes.
Whether that led to the death, perhaps you're saying is something that needs to be established.
No, I entirely agree. No, what I'm saying is these are system failures. If there are regular checklists, if there are reporting systems of stockouts ought to be prevented. So these are things that require correction at multiple levels. We can't just have an acute knee-jerk response and forget about it till next year. The system needs to be corrected in multiple levels. And that
you're absolutely right in pointing out that the system needs to be corrected at multiple levels.
Early detection and surveillance. But the whole issue of hospital management. Where is the expertise in hospital management? Where is the accountability for failures in hospital management? And this is not a problem only of Gorakhpur. It occurs in many other places too. So we do need much stronger management practices.
You're right in pointing that out, but on the issue that both you and Sujatha Rao mentioned, and that has to do with the vector-borne diseases. Now, I'm looking at an India Spend report of March of 2016. India Spend reported a 3% decline in allocations to the National Vector-Borne Disease Control Program. This covers malaria, dengue, chikungunya, Japanese encephalitis, kala azar, lymphatic filariasis, from 482 crores in 2011-12 to 463 crores in 2015-16. Interestingly, over this period, Japanese encephalitis, the cases rose 210%, the death toll 181%. Shailaja, Chandra, let me put that point to you. If this is such a scourge on India's healthcare system, on the Indian people, then how do you explain this cut in budget?
See, it's a no-brainer that much more investment is needed. But no political party, no government is keen to put money because unlike roads and bridges and things which shine like buildings, investment in health is seen as a bottomless pit. You can spend money on immunization, you can spend money on antenatal care, on institutional deliveries. Those are things which are visible. But doing anything which is of a preventive kind or doing an institutional, what Sujatha called a technical audit, if these things have to be institutionalized, then they require health to be made into a top priority. Today, it is not a priority for anyone. A certain amount of lip service is paid, investments are poor, district hospitals are completely overflowing. And I think the point which has to be made about Gorakhpur, which is something which really begs attention, this encephalitis problem is not 1 year or 2 years old, it's going on for 4 decades. Number two, this is the only hospital in a range of 300 kilometers, serving Gonda, Basti, the Tarai region of Nepal, Bihar. If that is so, much more investment and attention was needed towards the management of this hospital, and that did not happen. And I would say lastly, that is the poorest of the poor, and they are dispensable. This is the tragedy of it. And if a medical audit were to be ordered, other countries have a kind of a peer review done whenever large-scale deaths are done on happen in an institutional way in a hospital. We don't have any review like that. Reviews are done by the same people who will whitewash things, and there's no public confidence that this will really lead to any betterment. I would say that a lot needs to be done. This is a tipping point has come. Something has to be done to put health not as a means of being able to say that we have put more investment, we have more schemes, we have more projects, but to say there is zero tolerance for hospital deaths, and to go into the kind of, you might say, investigation for 1 or 100, it doesn't matter. It could be sterilization, it could be oxygen, but you have to go into it and fix responsibility. That's not happening. It's all a blame game. It'll all be over in 10 days and we'll be back to normal. That's the unfortunate part.
It may not even take 10 days for this to blow over, Shailaja, Chandra. That, unfortunately, has been the experience in this country. But let me go across to Kiran Mazumdar-Shaw. Kiran, Shailaja, Chandra is saying that this is a tipping point. There should be zero tolerance for deaths within hospitals. And, you know, something needs to be done. You've called it a wake-up call. I might add, it's the latest wake-up call for India's ailing healthcare system. Where do we go from here, Kiran?
You know, Shereen, the quality of healthcare in government healthcare delivery systems has always been a big question mark. And I think this is a wake-up call where I believe that we need to have a transparent disclosure of audits that need to be conducted on all hospitals and primary health centers. Because I know, you know, having adopted some primary health centers through our CSR, how dismal and abysmal the state of primary health centers are, especially in rural India. So I think there is an urgent need for the system to really introspect. I also know how deep-rooted corruption is at the sort of lower levels, which is also a huge problem. So administration, you know, for instance, when anyone visits a hospital at a senior level, everything is orchestrated in a way to show that things are functioning. But I think when you start looking at how actually things work or don't work, you'll be shocked to see how bad our systems are. There is no governance. There is absolutely no accountability. And there is a lot of deep-rooted corruption at lower levels.
Lack of accountability, lack of governance, deep-rooted corruption, the many malaises plaguing India's already broken healthcare system. But Veena, let me come to you now. You know, as a reporter who's tracking this story, and you've of course been tracking healthcare for over 2 decades now, what stands out about this story in particular? And while we can talk about how Japanese encephalitis is a 4-decade-old problem and nothing new about the abysmal state of infrastructure in Gorakhpur's healthcare system, what strikes you as being odd about this particular story?
In this case, so health has never been a priority in India, and health reporters know the drill of landing, parachuting in when crisis happens and going through the drill. What's happened with this government in particular is that it's quite shocking how effective they are at information clampdown. The Gorakhpur hospital is a fortress right now. In Lucknow, it's impossible to get information from the state health officials. No one's talking, and very simple procedures that are followed across sectors when train accidents happen or flight accidents happen. You have a list of people who died, what's their age, whatever are they in for. It's been 3 days and we still do not know exactly how many patients were in there for treatment of Japanese encephalitis, how many were in there for respiratory illnesses. From what we now understand is bodies are being handed over without autopsies being conducted. The second aspect is how the media, today the Chief Minister did a press conference where he requested the media to not do fake reporting. Yeah. The thing is, anything that's on social media or put out by media with sources, the government just simply calls it fake media and does not address the questions that are being raised. We saw the exact same thing happen in the Zika cover-up in Gujarat a month ago, where what surprisingly here is the first time I'm seeing in 20 years is health officials are flying blind in here. They've never had data. India is not a data-rich country, so these people are already working without reliable data, so they can't forecast every year how many cases we can expect in that particular hospital. Yeah. But now on top of it, they are scared to talk and give out real information, even within the department. And that's new and that's scary because this government has handled every single public health emergency that's happened in the last 3 years in a manner, it's been 2 days now and I haven't seen any official taken the priority to comfort the grieving families. The priority has been to deflect responsibility and we are going after the company which was simply chasing payment for money that they wanted. So,
you know, let me, Sujatha, I'll come back to you and for the benefit of our viewers, and this was the point that both Sujatha as well as Shailaja, Chandra were making about Gorakhpur in specific before we talk about the overall healthcare system. And this is information that Brookings India has put together. 37% shortage in the availability of sub-center in Gorakhpur district. Only 45% of villages in Gorakhpur district have access to a sub-center within 5 kilometers. 95.7% shortage of male health workers in sub-centers in UP. 35 sub-centers in UP are without water supply. 31% without electricity. No sub-divisional hospitals in the Gorakhpur district. I mean, you know, I could go on. And finally, Healthcare Infrastructure Index shows UP ranks in the bottom 3 among big states in India. Sujatha Rao, the point that I'm trying to make is that the healthcare experience has been patchy and inconsistent across India. It's a state issue and it's addressed and dealt with differently by various state governments. How do you ensure some degree of consistency, some degree of standardization, some degree of overall regulation?
Well, you know, in this particular case, while health is a state subject, that's correct, but in the 7th schedule, infectious disease is a concurrent list. So the government of India is as responsible and should be held accountable for what is happening today on infectious diseases as the state government. So it's not as if it's only the state government that can be held accountable. What was the government of India doing? And there are 2 things I would like to just quickly mention. One is that the policy attention is getting so obsessed with only institutional deliveries and maternal infant mortality, which are very good indicators, no doubt. But infectious disease is something that you cannot say, I will look at it in 2022. They don't wait, and they cut across boundaries. So, you know, the externalities of infectious diseases and the intensity with which they can have in terms of outbreaks is so important that a consistent and a constant vigil at every level is absolutely essential and it cannot be compromised with. And I'm afraid this is what is happening. We are not giving any attention to infectious diseases. And my biggest worry is if we politicize it and data is not, if media is going to be clamped, and, you know, media is one of the most important sources of information recognized in the surveillance of diseases world over. So if we don't allow media to talk and if we tend to politicize it and suppress data, we will never know what's really happened. Because in this case of deaths in Gorakhpur, it's not just a question of Japanese encephalitis. More worrying is the meningitis, which is a fatality rate is far more serious. And there could be other kind of viruses that are also emerging. We need to know the truth, because this is very important for population health and for the security of even you and me, because we are also not secure from getting infectious diseases just because we belong to an elite society. So this is where I think, where infectious disease is concerned, I would be so happy if PMO itself could monitor the implementation, non-procurement of essential drugs, tests and all that. This is a failure which cannot be accepted. So sorry, now that was something I wanted to say. Shereen, what did you, what was your question?
No. I'm glad that you made the point. I'm glad that you made the point, and this was essentially what I was asking you. But let me take that point across to Dr. Reddy as well. So, you know, one, of course, issue that we always talk about is the overall spending by the government on healthcare, and it doesn't compare. Even if you look at other emerging markets or other emerging economies, China spends 5.6 times more. Forget about countries like the US, etc. But even when we talk about unutilized funds, and I'm just taking a look at the data, and this is of course reports by various media organizations. There's a report of October of 2016 which says that this particular medical college is sitting with unutilized funds under the government rogue scheme to the tune of about I've lost that number, but they had been allocated about 4.5 crores in 2013, and only 1.65 lakh rupees was actually utilized by this particular medical college. So one is the issue of lack of government spending or the shortfall or adequate government spending, and the other is the not efficiently utilizing the money that we already have.
Well, part of the problem, of course, is that the funds which are allocated, low as they are not adequately or appropriately utilized, because the infrastructure and human resources are so low that the absorption capacity is also low. We have to do front-end spending in order to improve the sub-centers, the primary health centers, and other parts of the primary healthcare infrastructure. But much more importantly, right from the community health worker level and other allied health professionals to the level of equipping the various primary healthcare facilities with adequate number of qualified medical personnel and even technology-enabled non-physician healthcare providers, that's very important. Unless we do that, we will not be able to spend this money properly. Secondly, systems. How do you procure drugs, even supplies like oxygen? Is there a transparent system of procurement? Is transparent system of ensuring that there are no stockouts? Now we have information technology available, and we can easily monitor the state of supplies. We can even monitor the state of payments. So how are these being utilized? So there is a problem in terms of actual design and delivery of primary healthcare services, as well as a faulty management process, which is actually impeding adequate monitoring of the delivery, even at tertiary care centers like this particular hospital. So we ought to actually bring in reforms at multiple levels, but also bring in a fair amount of accountability.
Yeah. Well, bring in reforms and accountability. But Kiran Shaw, let me put that point that Mr. Reddy raised there, that there is something wrong with our design and delivery mechanism. How do we ensure that there is standardization, that there is consistency? The point that I was raising also with Sujatha Rao, Kiran.
So, Shereen, let me be very honest. Irrespective of who is, at the state, level in terms of the political party, I think this is a much deeper question. I think this is across the board, across states. I don't think it matters which government is in power, because I think you need a systemic change in the way we are going about healthcare delivery. And this has been going on for years and years, and we've turned a blind eye to it. So I really believe that this needs a total revamp. I think this is an opportunity, since so much focus has been brought on this particular tragedy. And I think we should use this tragedy not to have any politicization of what is happening, because no political party is free of this particular type of act in any state. I mean, this is not the first of the many reported deaths, as you know. I mean, babies have died all over the country, and I know that there were some news items flashing that every year between 500 to 600 reported baby deaths are taking place. This is shameful. And obviously, this is a wake-up call, and I think we need to take a corrective and preventive action. So I personally believe we've got technology today that can bring in greater transparency. You must have CCTVs in all primary health centers and hospitals, at least to show what's happening, whether doctors are actually coming there, whether actually people are dressing up the way they should. They keep showing you people wearing masks and gloves, but do they really wear it all the time? These are questions that we need to ask. We also saw a lot of equipment in, at least in the pictures. So there's no, the hospital in question seems to have at least good equipment. But are they functional? Are they being maintained? These are the questions. I mean, okay, the whole issue about oxygen supply was absolutely horrific. But I'm sure this happens everywhere. Bills not being paid, essentials not being supplied. I think this is a deep-rooted governance issue, accountability issue, which needs to be addressed. So I think a lot of online systems, a lot of transparency in sharing audit reports to the public is going to make a difference. We keep, trying to cover up, and that's not going to help. I don't think it is the intention, and it should not be the intention of any blame game at this point in time. I think the UP government itself has an opportunity to completely revamp its system and make it an online digitized system.
Well, you're absolutely right, Kiran, and that is the focus here on CNBC TV 18. We're not indulging in blame game at this point in time. We do want to try and design or help design a roadmap for corrective and preventive action. We'll take that issue up after this break, but very quickly, Veena, in terms of Vidya, sorry, my apologies. But in terms of the way that this has been managed, before we move away from Gorakhpur to address the larger issue, the way that this has been managed, your thoughts on that?
I feel like the government has put every step wrong from the second this began. The first reports came in and the government flat out denied that there was any oxygen shortage or any deaths because of that. Then they put a media gag. Then when parents got on TV channels and had dead bodies and crying parents, that's when they say, okay, something has gone wrong. Since then, they have charged the company and not the health secretary or the mission director of National Health Mission. Nobody responsible so far has come out and in front of the camera who's responsible for the program has actually come out and given hard facts that these many people came in, these were the patients. Instead, what we've seen is denials and placing the blame on private parties and just no admitting of any sort of if not wrongdoing, just gaps in the system that need to be addressed. The UP government refuses to believe that they might have been at fault at any level, which is a serious problem at this point.
All right, we'll take a break on that note, but when we return, the corrective and preventive action that can be taken, that and more on this special discussion on what's ailing India.